PharmaPal.
You're listening to Bloomscast, the official podcast of Blooms.io, home of the bioactive library for mass spectrometry instant optimization. Let's dive into the latest in natural chemistry, bioactive discovery, and the future of lab innovation.
Today, we're jumping into a topic that comes up a lot: using natural products during pregnancy. We've got some really interesting scientific research here, and the plan is to really get a handle on which products people are using, what they're using them for, and crucially, what the science actually says about whether they're safe or not. We really want to lay it all out clearly so you can walk away feeling like you really grasped the specifics for each one.
Exactly. And, there's this very common feeling out there that natural automatically means safe, especially during pregnancy. It just sort of feels intuitive, doesn't it?
It really does.
But when you actually look at the research, the picture is, a lot more complex. And sometimes these natural things can carry risks people just don't expect.
So just how common is this? Are we talking a small niche or is it widespread?
Oh, it's surprisingly widespread. The sources we looked at suggest that, globally, both in developing and developed countries, the numbers range anywhere from like 1% right up to maybe 60% of pregnant women using herbal medicines.
60%? Wow. Okay, that's huge in some places.
It really is. And that massive range tells you a lot about how much, culture and local traditions influence these choices.
And I guess a big part of that is still that underlying belief that natural options are somehow gentler, safer for the baby than, say, synthetic drugs.
That's definitely the perception the research points to, yeah. Many women seem to choose them because they believe they're the safer bet. But here's the catch, and it's a really important one. Even though so many women are using these things, our actual scientific understanding of how they work, the benefits and the potential downsides during pregnancy, it's actually pretty limited for a lot of these plants.
So loads of use, often based on that natural safe feeling, but maybe not always backed up by solid pregnancy-specific science.
Precisely.
Yeah.
There was even one study suggesting that maybe over 78% of women might not really have the full picture about the potential hazards involved. There's a definite gap there.
Okay, so let's try and bridge that gap a bit. The research you pulled together starts by outlining categories of plants that, based on the evidence we have, probably should be avoided during pregnancy because of potential harm. Let's start with the ones listed as having abortifacient activity. What does that mean in simple terms?
Right. Abortifacient basically means these plants have compounds that could potentially induce a miscarriage or abortion. And the research flags quite a few where studies, often in animals, suggest this risk. Things like Abrus precatorius, that's chicory bean.
Okay.
Acaranthes aspera, sometimes used for pain. Ailanthus excelsa, and even aloe vera latex. Now, this is interesting because aloe vera gel, the stuff you put on sunburns, is generally fine topically. But the latex, that's the yellowish stuff just under the leash skin that people might take orally. Maybe as a laxative, that's the part carrying this specific risk.
Okay, that's a crucial distinction. The gel is okay, but the latex taken internally isn't. Good to know. The list was quite long, though, wasn't it?
It really was. Let me see. We also have Aristolochia indica, Areca catechu, which is betel nut, Bambusa vulgaris bamboo, Cassia occidentalis, Cicer arietinum chickpeas, believe it or not, Dolichondrone falcate, Indigofera trifoliate, Matenus ilicifolia, Momordica cymbalaria, Moringa oleifera, which is used for tons of things traditionally, Luceriacea, Oxalis corniculate, Phytolacca dodecandra, the African soapberry, Plumeria rubra, frangipani, Ricinus communis, that's the castor oil plant.
Right, we'll probably come back to that one.
Definitely. Then rutogravulans, or rue, Senna alata, and Stachys lavendulifolia. It's quite the list.
It is sobering, isn't it? Seeing how many things with traditional uses pop up here, it really drives home that just because something's been used for a long time doesn't automatically mean it's safe for everyone, particularly during pregnancy.
That's such a key point. Traditional use often evolves without the kind of rigorous safety testing we now expect, especially for vulnerable groups like pregnant women.
Okay, let's move to the next category. Plants that might stimulate uterine contractions. Which ones should we know about there?
Well, the research mentions Allium sativum, which is just garlic. But, importantly, this is generally a concern only with excessive doses.
Right, so cooking with it is probably fine.
Exactly. Your average amount in food likely isn't the issue, but taking large amounts, maybe in supplement form, could be. Chamomile nobile, that's chamomile, also comes up here, again, specifically mentioning high dosages. Then there's Simicifuga racemosa, black cohosh, and Hydrastis canadensis, which is golden seal. For golden seal, the research is pretty clear about its uterine stimulant effects being a reason to avoid it.
Chamomile again. Interesting how some herbs appear in multiple cautionary categories. What about emmenagogue potential? What does emmenagogue mean?
Emmenagogues are substances that can stimulate blood flow, specifically in the pelvic area and the uterus. This increased blood flow can potentially trigger menstruation. Lavandula latifolia, a type of lavender, is listed for this reason and is contraindicated. And interestingly, mentha piperita peppermint and, as we just mentioned, chamomile are also noted as having emmenagogue properties.
So even things we think of as gentle, like peppermint or lavender, could have these effects on the uterus.
Potentially, yes, especially if taken internally. The main concern with the emmenagogue effect relates to ingestion. Aromatherapy might be different, but the sources flag internal use.
Got it. Okay, next risk. Antiplatelet activity, things that might cause prolonged bleeding.
The main one highlighted here is ginkgo biloba. It's known for thinning the blood, which means it could potentially lead to excessive bleeding. That's obviously a concern around the time of labor and delivery.
Yeah, definitely. And ginkgo is another really popular supplement people might take without thinking about pregnancy.
Exactly.
Okay, what about teratogenic effects? Substances that could cause birth defects.
The research specifically calls out two here. First, rutagravulins, or RU. Studies have shown it can interfere with the very early stages of embryo development and transport, leading to a higher rate of abnormalities. And second, Trigonella phonogrecum, which is fenugreek. Animal studies have shown a potential risk for congenital malformations, things like hydrocephalus, which is fluid on the brain, or spina bifida.
And fenugreek is often used after birth for milk supply, right?
It is, yes, which really highlights how critical timing is. Something potentially helpful postpartum might carry risks during pregnancy itself.
That's a really good point. The list of risks goes on. Properties that mimic progesterone or estrogen, possibly increasing miscarriage risk.
Vitex agnus castus, or chaste tree, gets a mention here. It's based on one case report where it seemed to disrupt hormone levels.
And then a potential risk related to zinc, neurobehavioral defects.
Yes, Valeriana officinalis, that's valerians. Some animal studies suggested it might interfere with how the fetus handles zinc. Zinc is vital for brain development, so theoretically, this could raise concerns about neurobehavioral outcomes.
Okay. And the last category in this initial avoid list was anticonceptive activity.
Right, that was Ricinus communis, the castor oil plant again. It has estrogen-like activity, which is likely why it's been used traditionally in some places to prevent conception.
This is a really helpful, if slightly alarming overview of plants that the research suggests need serious caution or should be avoided. To help fix these in our minds, maybe we could revisit those examples you gave earlier, rue and aloe.
Absolutely. So, rutagravulins, rue, has this long history of traditional use for all sorts of things, joint pain, digestion, skin issues, you name it. But then the science comes in and shows these teratogenic effects can actually harm the developing embryo early on. Studies found more abnormal embryos when exposed to it, quite a contrast to its traditional reputation. And with aloe vera, like we said, the gel for topical use is generally okay, but the latex taken orally can stimulate uterine contractions, potentially leading to miscarriage. It really shows how crucial it is to know which part of the plant you're talking about and how it's being used.
That really clarifies it. Okay, so beyond the definite avoids, the research talks about products where the advice is more inconsistent or cautious. Seems like the gray areas. Let's start with ginger, because that's so common for morning sickness.
Right, ginger, Zingiber officinale. It's incredibly common, mainly used for nausea, vomiting, morning sickness, and indigestion. And there is some good news. At lower doses, the research often mentions around 1 gram per day. Some studies do suggest it can be effective for nausea and vomiting in pregnancy, and those studies didn't report major side effects.
Okay, that's reassuring for a lot of people, I imagine. But I sense a but coming.
There's always a but, isn't there? At higher doses, potential issues can emerge. Things like anticoagulant affects blood thinning again, cardiac arrhythmias, irregular heartbeats. It might aggravate IBS or ulcers, increase bile secretion, cause heartburn. There's also some conflicting evidence about a possible risk of abortion, but only at very high doses, so caution is a general advice. And you could also get allergic reactions or dehydration if you really overdo it. Animal studies are mixed too. Some show no harm at certain levels. Others hint at potential miscarriage or teratogenic effects. Again, usually at very high doses.
So it sounds like dose is absolutely critical here. A little bit might be helpful, but too much could be problematic. What's the thinking behind how ginger might cause issues?
Well, some of it relates back to that emmenagogue effect, potentially increasing blood flow to the uterus. It can also inhibit platelets, affecting clotting. And then there's a specific compound, 6-gingerol. Lab studies raise theoretical concerns that might interfere with blood vessel formation in the embryo or affect cell growth. Again, mostly lab findings, but they add to the picture of why very high doses might warrant caution during pregnancy.
Interesting, okay. What about saffron? You mentioned that briefly.
Yeah, with saffron, the main flag is a suggested increased risk of miscarriage, especially if exposure is high. One source even specifically advised pregnant women who might have high exposure, like those working in saffron processing, to limit their contact.
Wow, that's specific. Okay, chamomile. It's come up a couple of times now. Let's look at it more closely.
Sure. Chamomile, Matricaria chamomilla. Traditionally used for stress, digestion, nausea. In traditional medicine, normal amounts are often seen as safe during pregnancy, but it's usually advised to avoid it with sedatives or alcohol. And as we mentioned, it does have those emmenagogue properties and potential to stimulate contraction, so excessive amounts are definitely a concern. There was also one case report linking regular heavy maternal use to potential heart and kidney issues in the baby, but, that's just one report. More research is needed.
So maybe a single cup of tea now and then is one thing, but relying on it heavily might not be wise. How about peppermint?
Peppermint, Mentha piperita L. Another popular one for nausea and digestion. Like chamomile, it has that emmenagogue effect. Some literature actually advises against using it in pregnancy because of the potential to promote menstruation or even abortion. There are also some concerns raised in certain texts about undisclosed levels of compounds like thujone and betaine in some peppermint products. Although, to add to the confusion, the Botanical Safety Handbook apparently doesn't list any known contraindications for it during pregnancy.
Right. It really highlights the inconsistency in the information out there, doesn't it? Makes it hard for people to know what to do. What about cranberry? Often touted for UTIs.
Cranberry, Vaccinium oxycoccus macrocarpon. Traditional use is definitely UTI prevention and treatment, sometimes as a uterine tonic too. However, the actual scientific evidence for it effectively treating UTIs isn't that strong. And it's really crucial to remember that UTIs in pregnancy need proper antibiotic treatment because they can cause serious complications. Plus, there isn't solid evidence for its safety or effectiveness in helping with labor, and its overall safety profile during pregnancy isn't really proven. So the advice is generally cautious use, and definitely don't rely on it instead of antibiotics for UTI.
That's a critical point about getting proper UTI treatment. Okay, raspberry leaf. Another one with a long history, especially around childbirth.
Raspberry, Rubus idaeus leaf, yeah. Traditionally used to tone the uteruses, assist delivery, maybe prevent miscarriage, but like many others, there's a lack of really solid experimental safety data. Long-term use is generally cautioned against. Research findings on potential harms are actually conflicting. Some studies show no issues, others raise concerns. Caution is particularly advised for women who've had C-sections or have a history of preterm labor or pregnancy loss.
So, again, maybe not strong evidence for benefit and definite reasons for some women to be careful. Valerian, often used for sleep or anxiety.
Valerian, Valeriana officinalis. Traditionally, it's often listed as contraindicated in pregnancy, but the scientific evidence backing that up is actually quite limited. We see conflicting animal studies, again, some showing no negative effects on fertility or the fetus, others raising that concern about potential fetal zinc deficiency we mentioned earlier. So it's another one where the picture isn't clear.
Okay. And sage, sometimes used postpartum.
Sage, Salvia fruticosimil.
Yeah.
Yes, traditional uses include postpartum recovery, infant care, stomach pain. But the advice is to avoid large amounts during pregnancy itself because there are reports of reproductive toxicity and a potential miscarriage risk.
And finally, in this caution category, you mentioned fennel.
Yeah, fennel is just generally contraindicated during pregnancy, mainly due to limited safety data. We just don't know enough.
Phew, okay. That covers a lot of the commonly used herbs where the advice is basically be careful or maybe avoid. Now, the research also touched on a few plants with risks that seem even more severe or well-established.
Yes, exactly. While not heavily detailed in the specific articles you sent over, it's worth noting that Aristolochia species are widely known to be dangerous and should absolutely be avoided. Your sources did give more detail on others, though. Like Ricinus communis castor oil, it's sometimes used, often unwisely, to try and kickstart labor. But this can be really risky. It can cause intensely painful, non-productive contractions, vomiting, diarrhea, dehydration. It can even cause the baby to pass meconium, their first stool, before birth, which can lead to serious breathing problems if inhaled. Definitely not something to try without strict medical guidance.
Gosh, yeah, sounds dangerous.
Then there's podophyllum. It's used sometimes for treating vulval warts, but it's been linked to severe adverse effects, including, tragically, fetal death in the womb, and is potentially teratogenic too. And a more modern concern mentioned is kratom. It's an herbal product, but use during pregnancy carries a real risk of the baby experiencing neonatal abstinence syndrome, basically, withdrawal symptoms, similar to what happens with opioid exposure.
These examples really hammer home that natural certainly doesn't always mean safe, and sometimes it can mean quite the opposite.
It absolutely does, which brings us neatly to some really important overall warnings and things to keep in mind.
Okay, let's hear them.
I think the single most critical takeaway is that the assumption that natural equals harmless is just plain dangerous, especially when you're pregnant. It's a nice idea, but it's not scientifically sound. For so many of these traditional herbal medicines, we simply lack comprehensive, high-quality scientific investigation into their safety during pregnancy. So until we have that solid data, the safest approach is often to consider many of these plants potentially unsafe throughout the entire pregnancy. It really highlights why we need science-based information and responsible use.
That makes total sense. And you also noted that safety can even change depending on the trimester, right?
That's right. Something traditionally used, perhaps right at the end for labor, or maybe very early on in some cultures, isn't automatically safe during the second trimester, for example. The stage of pregnancy matters.
So, boiling it all down, what is the single most important piece of advice for anyone listening who is pregnant or thinking about it and considering using any natural product?
Without a doubt, talk to your healthcare provider, your doctor, your midwife. Talk to them about anything you're using, or even just thinking about using. These products can interact with other medications that can affect pregnancy complications. Even seemingly mild herbs have active chemicals. These chemicals can cross the placental barrier and reach the developing baby. Seriously, open, honest communication with your healthcare team is absolutely essential.
That really is the crucial message.
Thanks for tuning in to Bloom's Cast, brought to you by Blooms.io. Stay curious, stay connected, and we'll see you next time on the frontier of natural product innovation.
PharmaPal.